Welcome back to this video series for anesthesia oral boards. My name is Dr. Louise Wen, and I'm an anesthesiologist at Stanford Hospital. Today's video will cover 5 style tips for anesthesia oral boards success. Links will be pasted in the description box below. Tip 1 is answer the question, and it has 4 parts. Part 1 is be efficient. The examiners have a lot of content to cover and they are pressured for time. Part 2 is know what you're being asked. They may ask you, what do you think questions, such as what is your assessment, what is your differential, versus what are you going to do questions, such as what is your next step, and it's important to differentiate between those 2 types of questions. Make sure you answered the question. It's okay to briefly touch on the pros and cons of your decision-making process, but it's important to end that with I would do X, Y, or Z next, not I could do X or Y or Z and never end up making a decision. Part 4 is say why. Immediately after you vocalized your decision, explain your thought process behind that. Tip 2 is stay in control. Specifically, be careful about the types of questions that you're asking the examiners. For example, if the examiner tells you the blood pressure is 50/20, instead of asking the examiner, what's the heart rate? Is the patient still in sinus rhythm? Instead, you can say, I would assess the EKG for any dysrhythmias and the heart rate. Tip 3 is prioritize your differential. When the examiner asked for my differential, I responded, my top 3 differentials for this patient are X, Y, and Z. And then I would pause, and that gives them permission to cut me off and continue asking another question. If they didn't cut me off, then I would respond and lower on my differential, and then I would list a few more and then wait for the next question. Tip 4 is voice quality. I came across a TED Talk by Julian, who is a communications expert, which motivated me to gain control over how I use my voice. So instead of ending my sentences with an upward inflection, communicating uncertainty as if I'm asking a question, I would make an effort to drop my voice register and end with a downward inflection to communicate confidence and control. I highly recommend that you check out Dr. Jed Wolpaw's anesthesia podcast, ACREC, specifically episode 34. He does 2 mock oral boards, and if you ignore the content of what the examinees are saying and just listen to the quality of the voice of the first versus the second mock examinee, it is night and day. The 5th and final tip is to use the pause. A common issue among examinees is that they'll use a lot of filler words such as or ah, or try to buy time by repeating the question back to the examiner. A very efficient technique is instead to pause for about 2 to 3 seconds and gather your thoughts so that when you are ready to speak, you can sound intelligent and eloquent. Please comment, like, and subscribe to this channel, and check out the other videos on anesthesia oral boards. Please subscribe, comment, and like this video. Oh my God.